Hello everyone, my name is Angel Gador and welcome to our presentation on care coordination. Today we will discuss its importance in healthcare and provide relevant information on the role of nurses and the continuum of care. This presentation will highlight effective strategies for collaborating with patients and their families, explain the rationales of ethical decision-making, identify aspects of change management, and discuss the impact of healthcare policy provisions that influence patient experiences. The Agency for Healthcare Research and Quality 2018 defines care coordination as organizing patient care activities and sharing information among all of the participants concerned with a patient's care to achieve safer and more effective care. Care coordination contributes to positive patient outcomes as care plans are well formulated for each patient and carried out correctly. Effective strategies for collaborating with patients and their families. Patient and family engagement is a significant component of care coordination. The first step of collaborating with patients is to show and treat them with respect to build a positive rapport. Patients are then able to put their trust and would be willing to work together. A study by Minier et al. 2020 formulated different strategies to help collaborate with patients and their families. These are applying more resources during patient education, such as books, videos, and manuals, giving patient access to their personal health information through a secure online platform, and the ability to communicate with their providers, addressing emotional state and providing help when necessary, informing patients about services and resources in the social care system available to them. Patients and health professionals must have a mutual understanding, clarity, and jointly formulate patients' goals, taking into consideration the best available evidence and clinical judgment. The study showed 96% of effectiveness in strengthening patient and family collaborative care. Culturally sensitive communication involves verbal and nonverbal interaction that requires respect for each other's values and beliefs to provide equity and culturally sensitive care. Healthcare professionals must recognize and understand cultural behaviors and practices that might differ from one's own and respect them, especially in decision-making and care planning. Staff must work around the patient's cultural preferences. Culturally sensitive strategies that help collaborate with patients and families include being aware of their cultural values, beliefs, and attitude, creating an open, honest, trustful, and respectful rapport with patients and their families, encouraging them to ask questions and actively listen to their concerns, include patients and families, and be open to their preferences in care planning and decision making. According to Brooks et al. 2019, these strategies help increase patient and family satisfaction, create better engagement, and improve their adherence to treatment regimens, thus improving patients' health outcomes. Aspects of change management. Change management help achieve goals that support healthcare staff through change, effectively guiding them to a successful long-term change and achieving desired outcomes. It is essential to manage a change when the team and available tools can no longer keep up with the organization's expectations. However, with the transition to change, proper guidance of healthcare staff is crucial to avoid affecting patient care. According to Barrow et al. 2022, Kotter's 8-step change model's adequate implementation of this change management guide prevents any effects on patient care and experience. These include the following. When goals are no longer met, create a sense of urgency for change. Select the right team to handle and lead the change. Formulate a vision and plan for the change. Communicate the vision and plan with the stakeholders. Remove any barriers that may hinder the change. Provide step-by-step goals. Build on the change and formulate strategies for achieving long-term change. Following this guide for change management, the healthcare staff's resistance to change is minimal. Thus, the patient experience, their perception of how care is provided, will not be affected. If anything, an increase in the quality of patients' outcomes and patient satisfaction which is meeting the patient's expectation, will be observed because of the implemented changes. The rationale for ethical decision-making and coordinated care plan. All healthcare professionals must follow their code of ethics in ethical decision-making. However, with all the ethical issues in the healthcare field, these code of ethics are not comprehensive enough to target all of them. According to AMER 2019, ethical theories should help during ethical dilemmas in the medical field, and healthcare staff must understand the ethical theories. Teleology and utilitarianism, deontology and principalism. Teleology and utilitarianism focus on the theory of morality and determining right from wrong by focusing on what will produce the best positive outcomes. Deontology discusses a basis for good or bad actions according to rules, such as be honest at all times and respect everyone. Principalism provides ethical theory, autonomy, non-maleficence, beneficence, and justice. These ethical theories will help ethically approach issues, allowing care coordinators to decide and explore possible solutions for the best outcomes critically. Impact of healthcare policy provisions on outcome and patient experiences. The Affordable Care Act, or the ACA, has improved patient experiences for over a decade. According to Raffogel et al. 2020, 11.4 million people got insured with the help of the Act, and most of them were grateful as they finally could seek help for their conditions. ACA protects people with pre-existing conditions from getting denied insurances. Many significant people were happy about this benefit, especially non-elderly adults with pre-existing conditions that say they have always faced discrimination based on their medical history. Medicaid expansion also helped lower-income individuals access health care. This has been very helpful for them since they can get the services they need at either no cost or a low cost. ACA also helped insurers seek health screenings that prevented late diagnosis and wellness programs at an affordable copay. They have low co-payments for accessing prescription drugs, and ACA lowered the costs for Medicare. All of this contributed to a positive patient experience. Nurses' role in coordination of care. Nurses are essential for care coordination to be successful, as they deliver the most direct patient care and are one of the many people who interact with the patients the most during their admission timeline. Patients have individualized care plans depending on their health and needs. Nurses help by collaborating with healthcare staff to improve patient outcomes. Their duties include developing care plans that involve the necessary interdisciplinary team, educating patients and families, monitor and evaluating patients and their progress while maintaining quality, safety, and patient privacy. In shorter terms, nurses help formulate and utilize a care coordination plan by carrying out the services and interventions for each patient.